Hi, today we're going to go through a couple of exercises to help to deal with tight hamstring muscles. The hamstrings are muscles here at the back of the legs, and to help build up bone density in the femoral neck, which is a bone in the hips that often fractures when people fall. So if you're a competitive athlete, this will help you. You'll be able to be more proficient. If you're just concerned about not breaking bones, obviously this will be a benefit. I would just like to explain a couple of things relative to sitting. So when we're sitting, what happens, that action here, these hips are flexed, and the muscles here in the front of the hips, the hip flexors, can get tight, and the quadricep muscles here will get short and tight. The response is when people stand up, that if you're tight here, either people will like round like that, and then that will tighten up the hamstrings, or sometimes people hyperextend their legs and the back arches out like that, again, because of tight quads. And in both positions, the spine is in a compromised angle, shifts the pelvis again, a compromised angle, and will cause stiffness and tightness in the hamstring muscles, and also reduces the blood flow. So when you're sitting, there's less blood flow down the back of your legs and in here into the top of your leg bone. And then of course you can't regenerate the bony structures because there's not enough nutrients getting to those tissues. The first thing in saying that, first thing we need to do is like release tight, short quads. This will help you with your knees or your whole body, the back pain. There are many, many countless benefits to your health when we go through this series of exercises. Okay, here you're going to need something like a rolling pin. This is just a bottle, and many people will have a foam roller, so foam roller would be really good. It can be a big one or a small one. If you have neither of those, or if you don't like doing the foam rolling part, you can just sit up like this and use the foam roller or use a rolling pin and just roll out your quads. It's of course not as effective. So if you have a foam roller, I have this small one. The bigger ones are a little easier. But I would do one leg at a time so your back doesn't hyperextend. So first we're going to roll out the quads and then do a strengthening maneuver for the hamstrings and to lengthen and strengthen. So the roller is out to the side a bit, and you'll roll from the knee and all the way up into the hip. And you can do this incrementally or in sections, but do make sure you get that full length. And I like to, you can see it, like adjust your leg position a bit, roll the leg in and out. We're not rolling on the IT band, the outside of your leg. We're just rolling on the quadricep muscles. And always make sure you have your elbows down with good core support so your back doesn't arch. When you get to the top, you want to release the hip flexors in front of the hip. And also turn a bit to the side. Right at the top of your leg, there's a little gap at the tensor fascia lata. And if you can get into your TFL a little, that will be a benefit. And now the other leg. Oh, if your quads, if you have a lot of adhesions in your quads, it'll be really painful at the first time you do this. But if you regularly practice, it'll get a lot better over time. You just need to regenerate those tissues. So we're starting down. I like to start at the knee, but whatever works for you is fine. And then work your way up incrementally up toward the hip joint. Some will find, you'll have particular areas where the fascia, it feels hard and thick. But over time, like I said, it'll gradually improve. And when you get near the top, try to get a bit on the outside of the hip like this, so into your TFL. Okay. So next for the glute activation and hamstring lengthening, strengthening, you'll need to set up at a couch or a chair that has a soft, cushiony surface. We're going to do here two options. The easier option I'll practice first. The right leg is up, the leg is straight, and the foot flexed. The bottom leg, left foot on the floor, the toes are pointing forward. Arms by the sides, palms down, ideally shoulders back toward the floor. For the neck angle, keep the chin toward the throat. Don't let the chin come up. and feel like you're lengthening the spine. Keep the shoulders back, engage your buttock muscles, and exhale as you lift. We're doing 15-second holds. The pelvis here should be level all across the front, and the abs engaged so that your lower back should not arch. And when you lower, make sure you land in the middle and don't crash to one side. This will help even out your SI joint as well. So now I'm putting left leg up, the foot is flexed, right foot on the floor, toes are angled forward. So toes, left foot, make sure. Now the upper leg, don't jam it backwards. You don't want to hyperextend the knee. Knees just like slightly bent. Chin toward the throat, really important, shoulders back. With your eyes look down through your body. And glutes engaged, your buttock muscles here at the sides of the hips, engage those muscles. Exhale, lift. Keep the hips up, shoulders down. So here we're setting the proper length of your hamstrings, the muscles in the back of your upper leg, and strengthening those muscles to hold your leg properly. The tightness often comes from they get pulled too much because of the tight quads. Slowly lower. So they feel tight, but they're actually overstretched. So we want the proper length and strength. So you can continue with that. You could do 2 or 3, 4 sets as you like to, 15-second holds. Next progression. Left leg up like this, single leg. So right knee, you bring it toward the chest. The left leg is toes flexed. The heel is pressing down. Chin toward the throat. Abs are braced. Your eyes are looking down. Glutes. Exhale, lift. Keeping the hips level. So first time, probably your hamstrings will cramp. And just stop, come down. You can practice the easier version, or just take your time, try again, and gradually, when your hamstrings and glutes are stronger, and particularly slowly lower, when the glutes are firing in the proper sequence, glutes first, then hamstrings, then you'll be no cramping. Cramping will stop. Other side. Left knee in toward the chest, right leg heel down, foot flexed, chin down, shoulders back, brace abs. You should have neutral spine. Exhale, lift. Hips are still level. And breathing. Relax your upper trap, so bring the shoulders down from the ears. And slowly lower. Okay. And relax here for a moment. Next is left leg straight. Knees slightly bent. You can always continue with the first one we did with the foot on the floor. Okay, you can just do that one. But again, when you get stronger and you want to progress, this time the upper leg is straight, foot flexed, knee not bending backwards, but is, straight leg. Right knee toward the chest. Now the neutral spine, that means in your lower back, there's a little bit of a gap. As you lift, your back shouldn't flatten down like that. That action will tighten up the hamstrings. So it should be neutral spine. This whole midsection is engaged. No fluctuation along the spine as you're lifting or lowering. Okay, right knee into chest, shoulders back, glutes, exhale, lift, neutral spine the entire time. In terms of the knees, when you're new to this, if your knees are weak, you'll feel it, but ultimately with this proper angle, you'll strengthen the muscles to hold your knees in place. Okay, and slowly lower, landing in the middle of the sacrum. Okay, switch sides. Left knee into chest, right leg is straight, not locked back. Make sure you're not using the thighs, the front of the legs. Think of using your buttock muscles. Shoulders back, chin down, glutes squeeze, exhale, lift. Shoulders down from the ears, chin toward the throat. And you're still breathing and your hips are level. Left shoulder back. And slowly lower midline. All right, now we have to get up. I would continue, do multiple sets, but here we're going to stand up. So how to do that? People often ask me that question. We're going to roll over to the right side. So left arm up, left leg up. I'm going to roll right over onto the right. Bring the leg all the way around, the left leg all the way around. And then come up, right elbow, left knee. Then we're on hands and knees, toes curled under, and downward dog get up. So lift the hips and walk the feet forward, not hands back. Walk the feet forward. Feet are flat. And then walk the hands back as needed. And then when you stand, just wait. You might be a little dizzy. You've lengthened the spine and got more blood flow into your head for our brain. And then as you stand and walk, just notice as you're walking and standing, notice your feet. The feet feel much stronger. Your toes are engaging. Your arches feel stronger. And even just standing, you've got much more core support and you can stand more upright. So thanks for coming. Have a great day. Enjoy yourself. We've got a lot of work to do and many fun years ahead of our lives. Thanks so much.